global CFR has declined from 2.2 to 2.1%. The CFR for Africa has also declined from 2.3 to 2.2%, and the World Health Organization African region crossed 2 million case mark on Wednesday, 6th of January, 2021. In Nigeria, we have crossed, unfortunately, the 100,000 mark and now rank second in the number of new cases, the fourth in cumulative cases in Africa, and the fifth in cumulative deaths. Last week, Nigeria recorded over 9,000 cases, in 1 week. You remember in week 53, we recorded about 5,000. But in the first week of January, over 9,000 cases. You know for sure that number, because of our poor record management, you can be rest assured that does not reflect what actually is on the ground. Realistically, if we estimate the numbers missed, we will be in a much higher region. There is no state in Nigeria that is immune to this pandemic, even if reports are not coming out of such states. The Honorable Minister of Health and the DG, Nigerian Center for Disease Control, will expand on the statistics during this briefing. It is, however, very instructive to stress that factors that have contributed to rise in numbers from late November 2020 included increased local and international travels, business and religious activities, reopening of schools without strict compliance with COVID-19 safety measures. The full import of the foregoing is to press further on the need for us all to elevate the level of our vigilance and compliance with the recommended non-pharmaceutical interventions. The current wave of infections is swift and virulent, and we do not know how long it will last. Besides, the facilities available for treatment of critical cases remain very limited, and we do not wish to be overwhelmed. But the indications are in that direction. Your best bet, therefore, is to avoid infections completely. The Presidential Task Force has continued to receive inquiries about the issue of testing before traveling out of Nigeria. For the avoidance of doubts, the protocol in Nigeria requires inbound passengers to test not more than 96 hours before boarding flights to Nigeria. However, for passengers leaving Nigeria, it remains the responsibility of travelers to confirm the requirements of the country of destination and that of the carrier of choice. The national coordinator will clarify the extant protocol and the policy position. For inbound travelers, a new protocol on pre-boarding has been released and compliance is strictly recommended. The additional requirements for passengers coming from the United Kingdom and South Africa also remain in force. The national coordinator will also speak on this during this briefing. Next week, the pilot exercise on the use of the rapid diagnostic test kits, RDTs, will be rolled out in 5 tertiary health institutions in Abuja. The DG, Nigerian Center for Disease Control, will expand on this. The isolation of different strains of the virus is being vigorously pursued. In this regard, the PTF is working with the Africa CDC and the Nigerian Center for Disease Control On the sequencing of the COVID strains circulating in Nigeria, we shall keep you informed as the exercise progresses. As part of measures to deepen community engagement and enforcement of protocols, the Presidential Task Force met with the Nigerian Governors Forum last week, operating under the auspices of the National Economic Council, and will be meeting with key religious and traditional leaders very soon. It will similarly meet with security agencies to seek their cooperation with the enforcement protocols. The third stream of NYSC members will resume on the 18th of January, and the PTF is working closely with the management to ensure that participants are tested and protocols are complied with. Finally, the PTF has advanced the preparation for the management of all aspects of vaccines discussed. Particularly, lessons are being drawn from other jurisdictions on the successes and the challenges of the vaccine administration. The Executive Director of the National Primary Healthcare Development Agency would elaborate on matters of vaccine and vaccine administration, as well as dealing with misinformation, conspiracy theories, and disinformation. I now invite the Honorable Minister of State for Health, thereafter the DG, NCDC, and the National Coordinator to brief you from technical perspectives. I thank you for listening and have a very pleasant evening. Thank you.
Thank you very much, Mr. Chairman of the PTF, my colleagues here present, media representatives, distinguished ladies and gentlemen. We have now crossed the 100,000 mark for confirmed cases of COVID-19 and evidence of increasing infection. As of this morning, 100,087 cases have been confirmed, while 80,030 cases have been discharged since this pandemic began. We have also sadly recorded 1,358 deaths in 36 states and the Federal Capital Territory. In the last 24 hours, 1,024 new confirmed cases were recorded in 17 states with 8 deaths. The case fatality rate stands at 1.36%. So far, we have tested a total of 1,025,560 people, with a positivity rate of 9.8%. Our testing rate in the last few weeks has increased as we continue to engage states to scale up their case finding and testing. We are working to meet our target of testing 2 million Nigerians within the shortest period. The result from the tests conducted on prospective NYSC members has incontrovertibly confirmed that no part of the country is free of COVID-19 disease. We safely and comfortably draw this conclusion because core members are mobilized from all the states of the country for each of the orientation camps. With the increased number of cases, the number of active cases has increased expectedly. As of today, we have 18,699 active cases on treatment, both in facilities and in the community, using the treatment protocols. Many of the active cases may require care in one of the treatment or isolation centers, thus imposing enormous burden on our facilities. The reports that many of those who died reported late for treatment at the approved centers because they were referred late from private facilities is alarming. We therefore once again seize this opportunity and when positive refer them to isolation centers for treatment. Attempting to treat suspected or confirmed cases not only exposes the health workers in such a facility to risk of infection, but also denies the patient early access to effective treatment in an approved treatment center. The plan of the federal government regarding activation of oxygen availability in the states is on course, with a view to effecting immediate repairs of non-functional oxygen plants. The weekly Case Management Partners Coordination Forum for 2021 is set to recommence on Wednesday, 13th January 2021. This is an avenue for continuous interface with different actors in case management towards engendering experience sharing. Finally, we are all reminded again that COVID-19 is real, but preventable. While we await the vaccines, we are enjoined to observe all non-pharmaceutical measures. Wear your face mask appropriately, especially when out of your house. Wash your hands with soap and water regularly, or use hand sanitizer where necessary, and avoid unnecessary travels. Permit me at this juncture to specifically emphasize the need to avoid crowding, as we see in people under the guise of national identity number enrollment. There is absolutely no cause for this, if only people would voluntarily comply with advisories and guidelines as issued by the Ministry of Communications and Digital Economy and its relevant agencies. The statement credited to me on the social media as to the suspension of the exercise is out of context, hence totally misleading. For the avoidance of doubt, Mr. President's order on the matter remains as being carried out by the relevant ministry. I'm also aware that the relevant agency normally invites people in order to create order. And the only reason for such invitation is for data capture or fingerprint capture. That is what I have as my understanding. And besides, the Honorable Minister made an elaborate presentation on this issue, I think last Friday. And all the Honorable Minister of communications and digital economy said still remain. Distinguished ladies and gentlemen, I thank you for listening.
Thank you. Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, WR, Directors, colleagues, gentlemen of the press. Thank you very much again for attending. Yesterday, we were reminded of the stark reality that we live in now. We are now living with a virus that has now affected 100,000 lives in Nigeria and well over 1,300 deaths in 11 months. And probably there are many more. That's what we've been able to confirm. The virus that causes this disease, COVID-19, is spreading very fast, causing mild symptoms in some and severe symptoms and death in others. And many people continue to experience fatigue and some symptoms even after recovery. So this disease in many people doesn't end after 2 weeks. There's a silent face to COVID-19. You cannot tell whether someone has had the virus or not. Yes, we have educated everyone on the most common symptoms, but there are also very vague symptoms of weakness, slight headache. So we're encouraging everyone to have a much higher index of suspicion. And also healthcare workers to don't waste people's time treating and looking for malaria and typhoid and so many other possible causes of illness. The strategy now should be to rule out COVID-19 before you go for the others. So test for COVID-19 is very easy to do so now. All the testing centers across the country are active. Their locations are on our website, ncdc.gov.ng. You can find any testing center across the country. Some places have more than others, yes, but there are testing locations across the country. If you feel weak, if you feel we have a bit of fever, headache, any of those vague symptoms, please, before you go testing yourself with rounds and rounds of anti-malarials, do that COVID test. It may save your life and the lives of others. So again, we're asking people to take some responsibility around the activities we're engaging in. When we say people should take responsibilities, when you organize a large gathering where people are invited, some people are invited and have a choice. Many others do not have choices. The people that work in these places don't have a choice on whether to come or not. They have to work. And therefore, if you're managing a facility where people are invited for a wedding and the place is full and heaving with people, at least there'll be many staff that are serving there that don't have a choice. So by doing that, you're exposing them almost deliberately to this virus and potentially to death. So we must all be aware of the consequences of the decisions that we're making. We're reaching a critical level with our hospital capacity in many towns in Nigeria. We must begin to protect our most vulnerable as we get deeper into this phase of the outbreak. While we may all be tired, remember this virus is not tired and is taking advantage of our tiredness and our fatigue. So again, I advise Nigerians to stay at home as much as possible, avoid large gatherings, especially indoors, with poor cross-ventilation. 100,000 cases are not just numbers. They are fathers, mothers, brothers, sisters, children, whose deaths we will all mourn, and the pain of their loss felt deeply. So at NCDC, we're committed to going over and beyond. Healthcare workers are working across the country to ensure that the response is sustained, while our colleagues at MPACD are working very hard to drive access to vaccines as soon as possible. We must continue doing the bits that we've been doing over the past 11 months. To elaborate a little bit more on what the chair said, we're rolling out the use of RDTs in 5 tertiary hospitals in Abuja from Monday next week. This will increase access to testing. We then intend to roll out across the rest of the country from February. This will make testing a lot more available to hospitals, both for healthcare workers themselves and patients coming to these hospitals. You will also remember that we use RDTs in NYSC camps across the country. We found that in every state in Nigeria, we tested people coming from different states, and we found positives among individuals that had reported to NYSC from every state in Nigeria, every single state in Nigeria. So there's no state that is spared of this virus. We would have been surprised if there were, but our data suggests that we were right in saying that there's COVID circulating in every single state in Nigeria, and we all have to continue the hard work that we're doing. So finally, we'll continue to count on government, religious and traditional leaders, our partners, the private sector, business owners, gentlemen of the press, but perhaps more importantly, or most importantly, all Nigerians in their individual capacity to help us control this phase of the outbreak as we all work diligently towards access to a vaccine. Thank you very much.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. So first of all, I would like to note that security agencies have ramped up enforcement of non-pharmaceutical interventions and compliance with our protocols, especially in the FCT and Lagos, which remain centers of the epidemic. Some entertainment centers have also been closed, defaulters arrested, and prosecuted in mobile courts. We would like to thank the state governments for doing this, but we are asking them to do even more to make sure that our protocols are complied with. This is the only way we can sustain and keep the country safe from COVID-19. The National Orientation Agency has also continued to have sustained engagement with Nigerians on its social media platforms to clear misgivings and disinformation surrounding the COVID-19 vaccine. This effort is the latest in a series of sustained awareness campaigns by government agencies to encourage the acceptance of the COVID vaccine when it becomes available. The PTF would like to commend this, particularly given the subsisting misconceptions by some segments of the population concerning the vaccine, and we hope this will continue to be sustained. The DG NCDC has already mentioned the issue of management of cases. It's very important that our healthcare workers realize when somebody presents with a persistent fever, especially if there are respiratory symptoms or a shortness of breath, it's possibly going to be COVID. So we are asking the general public to have a heightened sense of awareness. Not every fever is malaria or typhoid. And if you're coming with a respiratory symptom, cough, or shortness of breath, or you have lost your sense of smell or taste, it's more likely to be something else, and get yourself tested for COVID because it could save your life. Again, we will keep on talking about the need for vulnerable persons to please stay at home. If you are above the age of 60, if you have diabetes, if you have other comorbidities, you're the person that COVID is looking for in order to cause harm, significant harm. So while we are not in lockdown mode, it's in your best interest if you fall within this group to lock down, because now is the time to actually keep away from the general public. Now is the time to keep away from mass gatherings if you fall within this group. Because if you catch COVID, you could end up competing for limited oxygen supply or a ventilator. Our beds are fast filling up in our treatment centers, and you don't want to be in a position where a decision is being taken as to whether or not you should go on oxygen or a ventilator. The PTF will also be reviewing, we're currently in the process of reviewing our protocols. We've had discussions with the state governors, including a review of curfew hours, particularly with the aim of addressing and sniffing out the issue of nightlife and entertainment, which is also driving the current numbers. And once this review is completed, an announcement will follow with regards to the curfew. In terms of international travels, we would like to provide additional clarification. So from today, Monday, the 11th of January, we have changed the validity of the COVID PCR test for those travelers, international travelers that are outside the country. You will need to present a PCR test that is negative and valid within 96 hours, not 120 hours, 4 days or 96 hours. If you present a COVID PCR certificate or result that has a validity more than 96 hours to the time of boarding, you will be denied boarding, and the airlines have already been informed. From today, it will also be necessary for you, if you are traveling into the country, to use the travel portal, fill in your health questionnaire, and upload your COVID PCR result, and print out your permit to travel or QR code. If you do not have a permit to travel, you will be denied boarding. And this is especially so for passengers coming from the UK and South Africa. You have to pay before you board for Nigeria. If you do not pay, the airlines will not allow you to board. As usual, we are discouraging all non-essential international travel. But if you have to travel, if it's essential for you to travel, please familiarize yourself with our travel protocols. For passengers leaving Nigeria, not every country requires a COVID PCR test. So it is your responsibility as a passenger to check with your airline or with the embassy of the country you are traveling to. If you do not require a COVID PCR test to travel out of the country, you don't need to bother. Do not engage with touts. Do not allow yourself to be siphoned of your hard-earned money. Travelers are cautioned to avoid third-party arrangements for their registration and or payment for the PCR test. The government has not authorized any agent or body to carry out registration and or payment for outbound travelers on our behalf. Please do not pay any third parties. Use the portal and pay directly, or go to a private lab to get your travel test. Tests outside travel are free. So public health, if you are testing for COVID within a public health setup, you should not be charged. But if you are traveling, you will have to pay for it. Please note that we are at the moment looking for passengers that are presenting COVID-19 PCR tests that are fake. If you take the risk of presenting a fake certificate and you are caught, you will be prosecuted. And not only you, but we will also find out the source. We have additional check mechanisms at the moment that we are implementing at the airports to stop this from happening. It's also important to note that inducement of Port Health Service staff or other airport staff is strictly prohibited, and defaulters will be liable to prosecution. Finally, just wanted to say that we cannot afford to continue to put our country at risk. We will continue to monitor compliance with our travel protocol and all our non-pharmaceutical interventions. We have already begun to sanction defaulters with the first 100 passports facing restriction. And this week, we will be finalizing the next list of 100 passports that would have travel restrictions placed on them. And we will continue to do this every week until we note an improvement in our compliance measures. I urge all of us to take responsibility for our health and for the health of our loved ones. We should wear a face mask when in public. We should use a hand sanitizer and maintain our physical distance. Thank you.
Nigerians have been concerned about the use of vaccines, COVID-19 vaccines. To speak on this and to allay such fears, let me please invite the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shoaib, to explain. Dr. Shoaib.
The Chairman of the Presidential Task Force on COVID-19, the National Coordinator, Honorable Ministers, members of the Presidential Task Force, distinguished ladies and gentlemen, good evening. Today I'm giving just a brief update because if you recall, on Friday we had a very rich engagement with people from different sectors of the media, and you guys were there as well. So I want to first and foremost acknowledge and appreciate your contributions. You had very, very exciting questions. You raised your concerns in a very transparent manner, and you were also able to use the opportunity to provide guidance to the PTF, to the Federal Ministry of Health, the National Primary Healthcare Development Agency, around how we can strengthen our communication around COVID-19. So we came away from that meeting really, really enriched by the conversation. In terms of the work that we're doing around providing better information about COVID-19, we're using exactly the same templates that the Presidential Task Force has been using in the last few months. So we're not reinventing the wheels. There's no need changing a team that is working well. We recognize the fact that because of the work of the Presidential Task Force, and to a great extent the work that you guys have been doing, we've been for the most part been able to communicate the right information about COVID-19. We're using the same channels to convey information about COVID-19 vaccines. There's nothing that is cloak and dagger, there's nothing that is hidden. And from our conversations, what we're beginning to see, even on social media, is that Nigerians are beginning to get the facts. We've disseminated frequently asked questions, and in different platforms, we're beginning to see people are asking questions, and even without us responding, we see Nigerians responding on our behalf because they know that the spirit of the Presidential Task Force is to see how we can, as much as possible, flatten this curve and get back to near normal ways of living. We continue to work very hard at the operation to try and meet the operational and regulatory requirements to access safe and effective vaccines. We are also watching the space, looking at what other countries are doing. As you are well aware, the Americans, the British are struggling to meet up with the coverage that they've earmarked for their citizens. Potentially because for a very long time they've not rolled out vaccines in campaign mode. While we learn from the best practices out there, we're also going to contextualize all of the great lessons we've learned from the polio eradication program, and we're going to be bringing it to bear as we roll out the COVID-19 vaccines. I know there are questions from people in the media that how can we possibly vaccinate as much as 40% of our population within 1 year? I'll assure you that this is feasible as long as the resources, the vaccines coming on time, we should be able to deliver on that target. Only in the month of October 2020, last year, we were able to reach as many as 23 million children under 5 with oral polio vaccines. We know that it's not exactly the same, but we do have the personnel that needs to be trained and retrained, and we do have the experience, and we have frontline technology that we're going to put to use when it comes to COVID-19 vaccines. There are questions around, why we're not producing the COVID-19 vaccines in Nigeria. I want to just put on record that the process of producing a vaccine is very complex and complicated. You don't just go to a shelf and pick up a vaccine. So it requires massive investments that have not been done for many decades. In the past, in the 1960s, I want to reiterate that we used to make yellow fever vaccines in this country. In the 90s, we took a decision to change our analog ways of making the yellow fever vaccines into the most recent technology. However, that transfer of technology never happened, and that is why we did not continue to make yellow fever vaccines. Perhaps if we had continued making yellow fever vaccines in the Yaba laboratory in Lagos, it might have been easier for us to continue and make other vaccines before now. So there is a genuine effort by this administration to restart the process of vaccine production. This is why the federal government went into a partnership, a joint venture agreement with BioVaccines through May and Baker. It takes usually 10 to 15 years for you to be able to start producing the vaccine. So it takes a very long and complicated process. But like they say, the journey of 1,000 miles begins with one step. And those steps have been taken by the federal government by getting into this joint venture and making sure that those partnerships with pharmaceutical companies have already started. I am a member of the BioVaccines board, and I know that the Honorable Minister of Health and the Federal Minister of Health is committed to making sure that we now drive the efforts that will make sure that in the not too distant future, we will be able to produce vaccines in good time. But the COVID-19 pandemic has come a shade too early for us to be able to produce the vaccines immediately. However, it does not stop, our research institutions from learning all of the process that has led to such a rapid production of COVID-19. The questions that people also ask, and this is one of the reasons why people have concerns about COVID-19, is that how come it's taking decades to produce malaria vaccine? It takes several years to get to produce other vaccines. How come it's taking less than a year to get the COVID-19 vaccine? Two very, very important reasons. Number one, this is the first time ever that we're producing a messenger RNA vaccine. Messenger RNA vaccines are usually faster to produce. Secondly, the folks that developed the COVID-19 vaccine did not start from ground zero. What it means is that there were precursor vaccines that were already in the laboratory. If you recall that in the late 2000s, we had the outbreaks of SARS. So there were so many scientists, so many companies that went into potentially working on the vaccines, because these are very similar viruses. What has happened is that because of all of that effort, people now invested money with the outbreak of COVID-19 to make sure that some of those precursors are fast-tracked to getting this vaccine. So it wasn't like the vaccines were just willy-nilly produced overnight. They went through a very, very rigorous process. I like to liken the production of the COVID-19 to what it takes, for example, to prepare bean cake, right? So if you want to prepare maybe moi moi, or is it kosei or akara, right? You could decide that, okay, I want to eat kosei, akara, or bean cake maybe next week. You've not taken the decision as to whether you want to take moi moi or whether it is kosei, but you know that you want to take a bean product. One thing that you can do to fast track that process is both the moi moi and the kose require you to wash the beans, to grind it, right? And then the final process is either you just cook it in a pot for moi moi, or you fry it in the case of kose or akara. So what has happened in semen analogy is that you have washed the beans, you have grinded it, but you are here to take a decision. You put it in the freezer or the refrigerator. When you now take the decision that you want moi moi, then you quickly cook it in a pot with water. If it is kose, then you fry it. So evidently, the time it will take for you to move from the grinded bean cake to frying or boiling in a pot will be shorter. This is exactly what happened with the COVID-19 vaccines. The precursors were already in the laboratory. They came and a pandemic. People invested money and cut short the processes. There's nothing about some wicked conspiracy theories about the COVID-19 vaccines. And I'm happy to see that Nigerians are beginning to get that. And on our part as the Presidential Task Force, we will continue to be patient, to listen. We will not dismiss those concerns, but we will work very hard to provide the information that is required to assure Nigerians that in the spirit of integrity and ethics, we will only approve vaccines that are safe for all Nigerians. Thank you very much for this opportunity.
Thank you very much, Executive Director, National Primary Healthcare Development Agency. We want this message to penetrate to our viewer and listener. May I now invite the Honourable Minister of Environment to please drive down the message.
Mr. Chairman, members of PTF, ladies and gentlemen of the press, good evening. Again from the Federal Ministry of Environment. Just a brief summary in Hausa. Jama'a assalamu alaikum. Muna da ci gaba da muku matashiya da kuma faɗa muku halin da ake ciki a duniya da kuma nan gida Najeriya a cikin ita wannan annoba ta corona wacce ta fito daga farkon shekarar 2019 har zuwa shekarar da ta wuce, kuma gashi dai muna tare da ita. Bari mu faro daga duniya sannan mu dawo gida. A halin da ake ciki yanzu kusan mutum miliyan 91 suka kamu da wannan cuta. An samu miliyan 64 waɗanda suka warke, kuma kusan mutum miliyan 2 sun mutu a sakamakon wannan cutar tun lokacin da ta fito. Idan muka dawo gida nan za mu ga cewa a yanzu mun kai wajen mutum 100,000 sama da haka kaɗan waɗanda suka kamu. Daga ciki wajen mutum 80,000 sun warke, sama da mutum 1,000 sun mutu. Wato abin damuwa a nan shine ta dawo fiye da yadda take baya. Har aka yi wancan karan aka gama, ba ma samun mutum 1,000 da suka kamu a rana guda. To amma yanzu kusan kullum waɗanda suke kamuwa sukan fi 1,000. Ko jiya ma an samu sama da mutum 1,000. Har ila yau wancan karan sai da aka yi wajen wata 3 kafin aka samu mutum 5,000 da suka kamu. Makonnin da suka wuce 3 zuwa 4 baya an samu mutum 5,000 da suka kamu a cikin mako 3. Muna mamaki. To makon da ya wuce waɗanda suka kamu mutum 9,000, kusan ninki. Kenan da gaske abin nan yana ci gaba da yaduwa. Menene dalilin? Ba wani abu bane iyakaci rashin bin dokokin da aka gindaya. Baya da muka fara samun sauki, mutane sun tsaya ne tsayin daka suna bin doka. Abubuwan da aka ce a yi, wanda aka ce kar a yi an bar su. Ba da bayan rashin bin doka, akwai harkokin aiki da mutane suka ci gaba da yi abinsu ba tare kuma da kare kansu ba. Cuɗanya da juna ko da yaushe yana ɗaya daga cikin dalilan. Tabbas an buɗe waɗansu makarantu, shi ma yana ɗaya daga cikin dalilan. Amma in ka duba ginshikin wannan dukka shine ƙin bin dokokin. mutane sun koma sun ci gaba da bukukuwa iri-iri, kuma abin takaici wani lokaci sai mu gama har waɗanda ya kamata su sani su guje ba su yi haka ɗin ba. To akwai damuwa kwarai in muka ci gaba da yin wannan. Ƙasar Amurka kwanakin baya kusan a kulliyomin sai sama da mutum 3,000 sun mutu saboda su ma da yawansu waɗansu sun ƙi bin dokokin da kuma abubuwan da mu ma muke kamantawa a nan. To gara tun farko ai matafka hanci mu koma bin dokokin nan shine zai samu mana sauƙi akan ita wannan annoba, domin tana nan in ba mu bi doka ba ita ba za ta tafi ba. Wato alamun cutar don mutane su sani, su ƙara sani, wani abu ne muna yi mai kullum, domin kuma a kullum din zaka ga ana kamuwa, kuma zaka ga mutane suna yawan su babu kariya, babin dokokin da aka ce. Mu sani cewa tari mara majina kamar tarin huka, zaka ta tari amma ba majina, zazzabi mai zafi, ciwon makogwaro, rashin jin kanshi ko wari, rashin ɗanɗano, kasalan jiki da makamantan haka. Tabbas akwai cutocin da suke da waɗansu daga cikin waɗannan alamun kamar mura, to amma yanzu tun da zamani ne na corona, idan ka ji wasu daga cikin waɗannan, to mafi sauƙi shine ka tabbatar ba coronan ba ce, ka je inda za a gwada ka. Akwai wurin gwadawa na gwamnati, akwai kuma na kuɗi, duk inda mutum yake so ya je a gwada shi. A sakamakon yunkurin da gwamnati ma take yi, in Allah ya kama makon da za mu shiga dai zuwa ɗan wani lokaci ma, gwamnati na ƙoƙarin ta ma ƙara fitar da hanyoyin da za ta gwada mutane ma wanda yake irin na tafi da gidanka nan take sha yanzu magani yanzu, domin waɗansu za su je asibiti ko na gwamnati ko na kuɗi da waɗannan alamun ba za a iya sani ba nan take. To wannan zai taimaka wajen nan take a duba a tabbatar ba cutar corona ba ne, domin irin haka ɗin rashin sanin yake sa jami'an lafiyanmu da dama daga likitoci zuwa unguwan zoma da makamantan haka suna kamuwa da wannan cuta su ma, waɗansu su rayu, waɗansu kuma Allah ɗauki ransu. To ya kamata mu tabbatar da cewa mun ci gaba da bin doka, me dokokin nan mu ƙara maimaitawa, kuma za ku rinka ji kullum dan har sai an bi su mun rabu da wannan cutar. Za a ɗan ɗauki lokaci, amma da menene aka ce hanyar lafiya a bita da shekara, shi ne dai har ila yau sa garkuwan fuska takunkumi kenan, wanke hannu akai-akai, da ka guji kuma taɓa fuskanka musamman baki da hanci idan ka san hannunka bai da kyau. In ba ruwa kusa, sinadarin da ke kashe ƙwayoyin cuta. Sannan har ila yau tazara tsakaninka da wani abokin mu'amalanka, ka guji zuwa tarurrukan da inda akwai mutane da yawa, shiga rintsi, tafiye-tafiye ma idan ba su zama dole ba kada ka yi su, domin na kamuwa da wannan cutar. Saboda haka jama'a muna fata za a ci gaba da bin wa'annan ka'idoji domin mu samu kanmu lafiya, mu rabu da wannan cuta cikin ɗan lokaci ƙalilan. Har ila yau kuma a kullum muna kira ga matasa da su ba da nasu gudunmawan na wajen tabbatar da cewa suna bin dokan, suna taimakon na ƙasa da na sama su ma su bi dokan, kuma suna yadawa a yanar gizo na yanda za a yi a bi a guje ma wannan cuta. Allah ya ba mu iko, Allah ya taimake mu.
Thank you very much, Honorable Minister of Environment, for driving that message. The time has arrived for us to take your questions. AIT.
Chairman, sir, members of the task force, my colleagues, Good evening. My name is Nancy Oyedia Oron from AIT. I would like to start with the DG of NCAA. Well, I'm aware that 4 billion naira have been released to airline operators to cushion the impact COVID-19 have had in that sector. But I'm a bit worried because there seems to be disagreement among some of these airline operators on the sharing formula. So I want to know, is there any measure the Ministry of Aviation have put in place to monitor how these monies will be spent so that Nigerians can benefit the dividends while it was released? Second question is to the Minister of Education. So my question is for you. Well, the NUC have mandated tertiary institutions to resume, I think on the 18th of January. I want to know, sir, looking at the fact that our numbers are rising, there's increase of infection among the youth, have you taken your time to tour the school to know if they are COVID-19 compliant? I want you to tell us that. And my third question is to the DG of primary health care. Well, you have mentioned that 40% of the population will be vaccinated this year alone. Well, I don't know if that is a target because we've had so many targets even in the PTF and it hasn't been met. And most of the vaccines we're expecting is from COVAX. But I want to know, aside the COVAX facility, what other measures are we putting in place? Because we've seen countries like South Africa that are receiving over 1 million doses of these vaccines, not from COVAX, but from the ones they have paid, which will be arriving very soon. And you said there are talks with some countries on how we'll get vaccines. But we want to know the timeline. How long will this talk take? Because just in week 52, we saw that we lost about 57% in 1 week. So we want to know, what is the time frame like? And secondly, still staying with you, I want to know some of these vaccines. I know that you've said that there are people that are of priority when these vaccines come. Well, I'm particularly concerned about the state because so many times the PTF have come up with guidelines on how this response should go, but the state will tell you, but we do not take orders from the center. So are there measures of how these vaccines will be monitored when it goes to the state? Because the state can decide to say, oh, the health workers are not our priority. It could be their family members. I want to know that. And number three, still staying with you, sir. After taking these vaccines, for the persons who will be fortunate enough to take them, does that mean they do not need to wear their mask? They can stay in gatherings? They are immune from contracting the COVID vaccine? The infection. Thank you.
Good afternoon, members. Good evening, members of the PTF. My name is Juliana Taiwo Balonye of the Sun newspapers. My first question goes to the SGF, sir. You admitted in your remarks that one of the factors contributing to the rise in number of cases include increased local and international travels. Why has FG not imposed flight ban in the UK? Why has the federal government yet to impose flight ban on the UK and US, despite the fact that most of the cases are coming from there? My second question is for the national coordinator. I know you said earlier that we are not in lockdown mode yet, but is the PTF considering a second lockdown? That's the rumor out there. And do you think the country can survive another lockdown? My last question is for the ES primary health care. How do we plan to raise funds to get the vaccine? Thank you.
Good evening, the SGF. Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa, and I report for Voice of Nigeria. My question is for the Executive Director, National Primary Healthcare Development Agency. So as we await the arrival of the vaccine, we have seen so many messages on the social media on misinformation and disinformation about the existence of COVID. So beyond this briefing, we had a robust Zoom meeting with you last week. Beyond all this, are you looking at a strategy to enforce the use of vaccine when it arrives should people resist compliance? Thank you.
Good evening. My name is Gloria Umezuke from Channels TV. My question is for the Minister of Health, State for Health. You dropped a hint earlier today about the possibility of a postponement of NIM registration. Can you clarify that, please? Are you planning to ask NIMSI to put a hold on this? Thank you.
Good evening, all. Rachel Abuja. My first question is for the Minister of Health. Sir, Nigerians would like to know the impact of COVID-19 in the health sector for 2020. And my next question is for the WHO rep. We would also like to know what WHO is saying about airborne of COVID-19. Thank you. Airborne transmission.
My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My first question is to the Minister of Environment, sir. Prior to the reopening of unity schools,
of the NTA.
Why you dey buy that product, make you dey careful, no go damage your life. You've got one life to live. Buy original. You should know where to go. The SOS. Don't touch, don't touch. It's fake. Don't touch, don't touch. It's bad. Don't touch, don't touch. It hurts. Don't touch, don't touch. It destroys. Don't touch, don't touch. It kills. You should know where to go. The SOS.
Nations the world over are still battling the dreaded COVID-19, with health and medical experts coming up with vaccines to tackle the menace to contain the spread of the virus. Back home, efforts are also in top gear to sensitize more people to the dangers of the coronavirus, with emphasis on the need for citizens to observe the very